Sports Medicine Orthopedic Show. We're taking all your questions. 877-698-3627. Let's head to Michigan. Matthew in Michigan. Hey, Matthew, you're on the air.
Hey, docs. Great to hear you guys back on the air on the regular schedule.
Yeah, thanks so much.
Yeah, thank you.
So I'm a 41-year-old man, hip arthritis. I like to play soccer and pickleball. My soccer team, I play once a week. It's kind of like Lomas's hockey team, where it's a bunch of guys who want to not get injured the next day. And right now, after playing, I have a really sore hip, kind of like in the front and the groin. And it's not as bad as if I take ibuprofen before playing. So 3 years ago, I saw a sports medicine doctor, and they said I had FAI and would eventually need a hip replacement. And both sides have arthritis, kind of worse on the right side. I've continued to lose range of motion. Right now, I can barely tie my shoes on the right side. I can't reach down. And yesterday, I went to see a hip surgeon who does a lot of hip resurfacing and total hips, and he said I was a good candidate for hip resurfacing, and that when I got hip resurfacing, I wouldn't have restrictions from playing sports after the surgery. So I've got a couple questions that I thought of course, after my appointment, which are, why doesn't everyone get hip resurfacing instead of the total hip replacement? And what makes someone a good candidate for resurfacing such that they, or not a good candidate such they would have to get a total hip? And then he said the resurfacing was metal on metal, and I heard that in the old metal on metal total hips that there were problems. And is that a concern with hip resurfacing? Overall, I'm just looking for reasons why I should or shouldn't wait to get a hip get hip resurfacing, and have your thoughts.
Yeah, great question, Matthew. So, first of all, glad you're still getting out there and going after it, playing soccer, and like we were just discussing, so wonderful to do a team sport that you're just thinking about scoring, and you get a great workout almost by accident. But obviously the hips, that's the classic soccer player hip is the FAI hip. A lot of times we start playing when we're young, and there seems to be potentially a correlation between hip development into FAI and playing sports like soccer that are very power, ballistic driven, so and getting FAI. So just to kind of cut to the chase, what are the indications for hip resurfacing? So typically we recommend them in patients who are younger. The reason being that there seems to be less wear from the metal on metal articulation. So a normal hip replacement, and just for our listeners, a standard hip replacement involves replacing the ball and the socket of the femur. And we cut the ball of the femur completely off. The socket, which is on the pelvis side, we put a metal cup, and then we put a plastic liner in that cup, typically. And then on the femur side, we put a prosthesis that actually goes into the canal of the femur. So bones are hollow, kind of like a pipe, and that prosthesis goes into that hollow area. And then you can have different materials to replace the head of the femur, which is the ball. So ceramic, you can have metal. And so that's your standard hip replacement, and they work great. And that would work great in you. There's no question that a hip replacement is a good operation. Still one of the most successful surgeries that orthopedic surgeons do. 95% satisfaction rate. So the likelihood that you're going to have a great result is very high with a hip replacement. The concept of resurfacing is instead of putting a prosthesis into the canal of the femur, you're actually only shaving the surface of the femur down and putting a sort of cap onto it. So it's still spherical, it's still like a ball, but it's more, if you want to compare it to like a dental cap, it's more like that. So you're putting a cap, you're preserving bone, and then on the socket side, you don't have a plastic liner, you just have this metal cup. And so the concept here is it's bone preserving. So if you ever need to convert to a hip replacement in the future, it's a much easier operation because you basically just cut the femur at the neck, where the ball ends, and then you proceed with your standard hip replacement. The reason not everyone is offered it is there are size limitations. So, just related to physics, if the radius gets too small, you start to significantly lose strength, and you basically develop something called a stress riser. So the neck of the femur is prone to breaking. So most women are out of contention for a hip resurfacing. You're typically looking for somebody over 5'10", and so that's where some, the line is drawn for some people. And then the other point people make is that if you're not very, athletic, if you're not going to use that hip and wear it down quickly, why do a more technically challenging operation? Just do the standard hip replacement, which is, widely done and practiced by orthopedic surgeons, throughout the country. So it is a more technical operation, and if you were to have it done, you'd want it done by somebody who does a lot of them. Well done. It's a phenomenal operation. You might have heard stories, and now just to bring Dennis into the fray, Andy Murray famously.
And one of the Bryan brothers, too.
And one of the Bryan brothers, yeah. Played, I think, doubles, but he actually played some singles matches.
Murray, this past year, played some single matches and
Wimbledon,
at an elite level.
Yeah.
US Open.
Yeah. So, you're talking about an elite athlete with a hip resurfacing who was able to miss very little. Maybe his productivity declined by a couple percentage points, but very close to his previous abilities. So I think it's a good operation done by a very experienced surgeon. Metal on metal, there are some concerns about metal ion production and whether that gets accumulated and can have some secondary effects. It seems to be related to whether or not the prosthesis is put in properly. So if it's very concentric, the wear seems to be a lot less. If it's a little bit off, then that's when you start to see more of this wear. We don't worry about it as much in men. We worry about it a little bit more in women, especially of reproductive age. But I don't see a reason. It sounds like you kind of reached the end of the line. It's bothering you now, doing the stuff you love. But I also just want to emphasize either one would be good, resurfacing or replacement. And I think you should just rely on your comfort level with the surgeon.
And my opinion, and certainly you're a hip surgeon, Lomas, and respect, your opinion more so. But I'm going to say, for men, again, unfortunately, most women are not candidates for it. But I think for men in their 40s and even 50s who are very active, athletic, it's certainly worth having that sit-down conversation with someone who does hip resurfacing, because it is such a great procedure. Both should feel like a normal hip, but I think the hip resurfacing just opens up more, really, just exactly like you were saying, Matthew, to all activities, right?
Yes.
Feeling like, hey, the hip that you had potentially when you were a young man and didn't have a problem. So, definitely you went to the right person, it sounds like, it is, like Lomas was saying, very technically challenging, and not everyone does hip resurfacing. So to have a sit-down conversation with an orthopedic surgeon who does both, I think is the right way to go.
Yeah, and I would just say, like every technique in medicine, and in this case orthopedics, the initial implementation of it was met with a lot of enthusiasm. It probably got over-indicated. We started understanding the limitations of it, and ruled out some patients, and now it's really found its niche, and you happen to be the exact kind of sweet spot for hip resurfacing. Young, athletic male. How tall are you?
And with respect to size, he had mentioned some unit of the femur. He said 48. I don't know what the units were, but he had mentioned the size of the
Well, how tall are you?
5'7".
Yeah, so then that you'd want to have a conversation with them, because a lot of times it is based on the size of the femur. So a lot of times they will have a cutoff of around 5'10" or 5'9", but some men who are, under 5'9" have femurs that are at an adequate size. So you just have to discuss that with them.
Yeah, he did the X-rays and said the measurements said I had a large enough femur. That's what I wasn't sure of, what the units he was referring to when he said the femur size.
So then you're good there. Well, it just increases the risk of there being a femoral neck fracture. But but if you have a head and a neck that are large enough, then it's not an issue.
Okay. And should I wait till I can't play soccer at all anymore, or is there no reason to wait?
So we would, just listening to you, having difficulty tying your shoes, and it sounds like it sounds like your time is ready. Yeah. It sounds like you're ready to go, right? It's about quality of life, and you're a young man, and your expectation is certainly different than a 70-something in terms of activity level. So it sounds like you're ready to go. Thanks, Matt. Thanks for your call. Sports Medicine Orthopedic Show. We're taking your phone calls, 877-698-3627, 877-NYU Docs. Interesting, though. What would you say, Lomas? You really, even like we're one of the biggest orthopedic departments in the country, and we have one one of our hip surgeons that does a significant number of hip resurfacing, even in all of New York City. There's a few that I typically hear about. So they really aren't everywhere. Hip orthopedists who do hip resurfacing. Yeah, and it just gets down to this kind of technical part of it, where it is a hip replacement has. There's a little, this sounds bad to say it, but there's a little slop in the system. You can get away with, if the height is a little off, it's just a very kind of malleable surgery, and people can do very well, even if the measurements are a bit off. And I know that might sound terrifying to people, but it's really true. Look, you're typically going in a hip that's just been mashed up. It's unrecognizable. And so it's not like there's an ideal, position. So that's where the total hip kind of sits. And that's why it's such a successful surgery. It really is one of the most successful surgeries in the history of medicine. And certainly still in orthopedics, it's one where you can almost guarantee a patient, if you have this, and God forbid, no complications and no serious risk factors, but you're going to do better than you were doing before. The resurfacing is just so much more technical. So as a surgeon, you then have to decide, am I going to have this be a large part of my practice? And because you don't want to be doing 3 a year, right? You want to be doing 100 or whatever. And so that's, I think some people just find that in their practice they don't see enough of that specific patient, like Matt was, 40-something, young, athletic, to warrant doing it. But look, I'm not a joint replacement surgeon. I don't do them, but I certainly see a lot of crossover with my younger patients who are sent for a hip arthroscopy but have arthritis, and they're no longer candidates for a hip scope. And it's tough, and it's actually good to hear Matt having an open mind. A lot of patients, they're 40, sometimes even a little bit younger, and it's just crushing to them. Like, what do you mean I've got hip arthritis? That I need a hip replacement? Like, I'm not old. And it's just you sort of have to get around that stigma that a replacement means that you're over the hill. It's just right. Some of us, whether it's injuries, FAI, impingement, or genetics, it's a joint. In some sense, for Matt, and if you had to pick a joint to have arthritis, in a young age, granted you certainly don't want it at all, but hip it's the best one. It's a good way to go. Yeah,
absolutely. No, it's the best one, and I think all of us have probably played sports. Like, I'm sure you played tennis with guys with hip replacements.
Yeah. And don't even know it?
Don't even know it, yeah.
Absolutely. Sports Medicine Orthopedic Show, 877-698-3627. Let's go to Pennsylvania.